Okay, thanks for starting the recording. Again, good afternoon, everyone. I'm Lisa Emerson. I'm a Senior Policy Advisor with the Division of Financial Regulation and leading this rulemaking for House Bill 3243 regarding ground ambulance balance billing. It looks like we've got some, new folks and also repeat folks, that members of our RAC, representatives from the insurance community, the ground ambulance service organizations, and also consumer advocates. As you know, this recording is happening, so you can tune back in, and those that maybe can't make it today, which that very may well be maybe possible, can review the recording to make sure they don't miss out on the details. So just some brief reminders about etiquette for the flow of the meeting. When you want to speak, please raise your hand, use the raise hand feature, and please keep your line muted when you are not speaking, which will help reduce the background noise. So if you are able to mute your lines, it's appreciated. What we'll do today on our agenda, if you can, the materials that were sent out to you along with the agenda are a copy of all the written comments, as well as you can see a link to the committee, the RAC advisory or the RAC committee webpage, where all the documentation is retained and that you can access. But we did provide a copy of the comment letters that were submitted after the first RAC meeting. We also provided a discussion draft of the draft rules as they stand today. We will take some time to discuss the standard statement of need and fiscal impact template that we complete for all formal rulemakings. And then we will have some time for public comment. And I went ahead and took the liberty of putting in what I know to be the next steps. We do have a RAC on the calendar for October 16th. And of course, any written comments are appreciated after this RAC meeting today by October 3rd. And of course, we'll have hopefully a robust discussion today about comments on the draft rules. Does anybody have any questions before we get started? Okay. Hearing none, what I'd like to do today, because we have had the public comments, I think I provided them to you when we had to postpone RAC meeting number 2 to today. We sent those out, and they have been posted for some time. But I do want to give an opportunity for comment submitters to go over their comment letter, and they don't have to go over it verbatim, but certainly hit any highlights or points that they really want to emphasize for this RAC meeting today. And of course, there will be time for a more substantive discussion and comment when we go through the actual draft rules. So I'm not sure who all is on today, but do we have anyone? Let's see, let's start with just kind of the order that I sent them out in. We could start with Sabrina Riggs representing the Oregon Ambulance, or the Oregon State Ambulance Association. Sabrina, if you would like to go over your comments, hit any highlights, you certainly are welcome to do so. Not sure if she's still with us or if we might have lost her.
I'm here. Sorry.
Oh, that's okay. Glad you're here.
It was that terrible timing where you called my name and then Teams just crashed out.
Oh, sorry about that.
My bad. So were you kind of just wanting me to walk through some of the main points for OSA's comment?
Yeah, just the things you want to emphasize, whatever you would like to do. Yes.
Yeah, I can do that. There are a couple of main points that we wanted to raise. The first is really, if you look down on, I think it's on page 2, but let me just double check that. But the first point that we want to raise is that EMS providers really need a way to figure out which plans are participating and not participating. And even backing up from that, which plans are ERISA, PEB, and OEB. Washington does a really nice job of collecting information of like all of the plans in the universe, and then in that universe, and then distinguishing like this ERISA plan has opted into the program and this one has not. And that's important for the providers, but it's also important for patients if they get a bill from a plan or from a provider and they think that they have these protections, but they don't because their plan has opted not to participate. And so we would just strongly recommend that DCBS keeps a similar list to what the Washington Insurance Commission's office is doing. And we've included that link there. And then the other sort of in the Washington vein issue that we wanted to flag is that we do have some providers of or members of the State Ambulance Association that are active in both Washington and Oregon. And so they have some experience with Washington's balance billing law as it's been rolled out over the last year or so. And what they're starting to see there is that there are a handful of insurers who, they have the same or very similar reimbursement structure as we do under our program where you pay the locally established rate that's included in the database. And if that doesn't exist, then there's the backup Medicare rate that insurance is required to pay. What we're seeing, though, in some cases in Washington is that some insurers are, even when there is a locally established rate that is included in that Good Washington database, it's not being paid. And insurers are just defaulting to the backup Medicare rate. And so we had hoped that the draft rules could address this. I don't know if it's maybe some enforcement language or even just really a clear pathway for if we happen to see a circumstance like that in Oregon and you're the EMS provider who's running into this issue, it would be nice if there was something in the rules that said, okay, and then if you're having this problem, report it to DCBS in this way, and then the enforcement action can be taken there, if that makes sense.
Yes, that makes total sense. Thank you, Sabrina. We will take that all under consideration. So thank you. All right. Let's go to the next comment letter that you have, Karen, on record.
Metro West?
Sure, that would be great.
Okay.
Yeah, go ahead and go with that. So is Sean, are you here today? Do you want to take a moment to hit any highlights in the comments from your perspective, anything you want to emphasize?
Sure. Thanks, Lisa. And kind of echo Sabrina's comments earlier. And also just we appreciate that there were a couple of the things that that we addressed that did make it into the draft package. And thank you for that. I think that we have some suggested language that that Tim or Sabrina can bring up later around mutual aid, but I know right about where you are there as you're scrolling or back just a step or two was the comment between the 30 days and the 90 days, and would just sort of re-emphasize that we'd still like to look for a longer than the 30-day period if that's possible, just to allow for the processing and everything to take place. But other than that, same comments as Sabrina at the beginning.
All right, thank you very much. You're on the line today, with us today. You'd like to talk about your comment letter, Cambia's comment letter, or just emphasize anything that you think still may be a need for rulemaking?
Okay. Hi, good afternoon. Can you guys hear me okay?
Yes.
Perfect. My name is Antoinette, and I submitted, I'm the Senior Public and Regulatory Affairs Specialist, and I submitted comments on behalf of Cambia Health, also doing business at Regents Blue Cross Blue Shield of Oregon and Brisbane Health Plans. Well, first of all, we support the intent of House Bill 3243 to protect consumers from ground ambulance balance billing. our comment letter basically, provides that, while using Washington's framework as a reference, is valuable, we recommend that the rulemaking really focus exclusively on provisions that require operational clarity under Oregon's specific statutory framework. And then, 3 points here. The first is that Washington's comprehensive statute includes provisions that are not in House Bill 3243, and as a result, creates some regulatory gaps and confusion. Second point is that important in applicable provisions from the Washington rules will create unnecessary administrative burden for both the department and regulatory entities. And then third and final, Oregon specific rules will provide clearer guidance aligned with our state's actual statutory requirements. So for these reasons, we also provided called out specific portions of the rules that we had a concern about or had additional comments in respect to recommendation that we'd like to see in the rules. First is the definitions. We respectfully request that the DFR define new terms introduced in the draft rule, such as mutual aid transport and allowed amount. We also oppose including the term out of network in the Oregon rules, because while this term appears in the Washington regulatory framework as non-participant providers, it's not present in House Bill 3243 statutory language. That's created even more confusion. So we really respectfully request that it be removed from the rules. With respect to the reimbursement framework, we really recommend, and this is for operational purposes only for insurers, we recommend using the Medicare rate effective January 1st of each calendar year to align with standard benefit year cycle. Of course, we know that the Medicare rate comes into effect if there is not an established rate. So if that's the case, for operational clarity and also to align with our benefit year cycle, that we use the Medicare rate effective January 1st of each calendar year. And then next, with respect to the catalog of established local rates, we provide that the statutory definition of established local rate really requires GASOs to include an analysis of the cost to provide the ground ambulance services. So consistent with, standard rate setting practices in the industry, this cost analysis provides essential transparency for both enrollees and payers. So we really strongly request that these cost analyses be included in the publicly accessible catalog as required by the underlying statute. We also recommended that establishing clear deadlines will be great, in that we will recommend October 1st be the date in which the annual submission deadline for GASO rates are to be submitted to the department. And then October 6th is when we would like to see the department publication deadline, which is essentially 5 business days after receipt of the rates from the GASOs. And then moving on along, we also recommend DFR adopt language in the Washington rules, which would require or which allows carriers to rely in good faith on rates submitted to the department. So our request specifically is to include a provision that permits health plans to continue using the most recent submitted rates for 60 days when updated rates are not submitted timely. This really would help us ensure continuity of operations and then prevent payment disruptions. And I'm also done. We also provided comments on, the creation of the database of the established local rates, and also with the self-funded plans option to opt in. We really do like what the Washington OIC has done, which is to provide an online opt-in form. And we would like for the DFR to consider adapting a similar functionality for Oregon. It's just very easy. We quickly go to the link, we put in the information necessary, and then we are done. So again, we are in support of consumer protection of brand ambulance violence billing, and we really appreciate collaborating with every stakeholder here to achieve that. So thank you for the time to summarize our comments and opportunity to comment on the draft rules.
Great. Thank you, Antoinette. So we can go to the next one. So is anyone from Pacific Source here today? I don't know if Rick Blackwell was able to join, who submitted the comment, or anybody in his stead. I know that everybody should, you have access to the comment letter. So please, if you haven't already, take the time to review those comments. We can go on to the next one. I think there maybe was one more. I think it was maybe Jeff Blake with the Fire Chiefs Association. It was more reiterating support of the comments submitted by the Oregon State Ambulance Association. But Jeff, you're welcome to highlight any of those comments you want to put emphasis on. You're welcome. I invite you to do so now, or we can do it as we go through the draft rule.
Yeah, I'd like to. Thank you for the opportunity. I apologize in advance. We're having construction on our station right now, so there may be some loud booms. They're putting a roof above my head, and obviously emergency services doesn't wait for anybody. That's why I was a little late. So what I'd like to make sure that that we have there is that I am in agreement with what Sean and Sabrina said in their earlier comments. And then what I would be really like to see is during the annual reporting period, is there a check here if this listed rates are accurate section? Can we have that included in the annual reporting period? Does that make sense? I'm not sure if I put that exactly how it was, but when we're doing our annual reporting period, during our annual reporting, can we have as check here a box that says check here if these rates are accurate or listed as accurate?
That is something that we are still discussing, how we can do that, how we can operationalize that to reduce the administrative burden, but also ensure accuracy and, that validation of what's submitted to the division. So, that comment is duly noted. But we are still discussing that on the logistics side of how that database will roll out. It may be a need to still enter some fields, but maybe not a lot of details if the rates have not changed, but there might be a need to still enter the entity name, the NPI, or of the governmental entity, that sort of thing. But we're planning to actually, I was going to say this later on as we go through the draft rule, that we will kind of have we've been talking to the Washington OIC folks that implemented their bill, and we will be looking to hold technical assistance meetings to before the database, goes public and is close to that rollout, to provide technical assistance to those that are going to be in that position of submitting information to the department. So I wish I had a more clear answer for you right now, but again, that comment is definitely duly noted.
Yeah, I think that's important to us from the OFCA level. And so I just wanted to point that out. Again, sorry for fumbling around. This noise is a little distracting. So thank you.
No problem. Thank you for being here. And good luck with the noise. All right, I think that we went over all that we have. Right, Karen? We got all 6.
Yes, and I apologize for not getting Jeff's comment letter
no
out.
worry. But I will also, yeah, go ahead.
Yeah, I'm having some technical issues here, so but
Okay.
all well.
And also for the record, just MODA, Scott White with MODA, the RAC representative for MODA, was unable to join us today, but and so we won't be going over those comments, but again, those are available to you. If you haven't already reviewed them, I encourage you to do so. The comments were mostly focused on things that are important from a lesson learned perspective about Washington's database that we should consider for Oregon's. So thank you for that. And so the next item, we'll go ahead and jump into discussing and going over the draft rules.
Jesus Christ.
So hopefully you can see all those clearly. And so just a reminder, if you're not speaking, if you could just mute your microphone, that'd be appreciated. Thanks. All right. So just again, the division has had an opportunity to consider the comments, and also we're kind of in that continuous, we had some time to make some adjustments, minor adjustments here to this first section of the draft rules. Which again, the actual Oregon administrative rule numbers will be eventually assigned. They will be brand new numbers that are kind of like in placeholder within our rule sets. So we will try to place them in a logical location within Chapter 836, Division 53. So under purpose and statutory authority, we do now have the actual Oregon laws 2025 Chapter 614, which is where House Bill 3243, the act, is codified. And so we put that in there. And then one of the comments that we also were able to implement was to emphasize that House Bill 3043 was enacted also to, one of the key reasons is to ensure that insurers pay ground ambulance service providers at certain rates. So that was another key point we want to emphasize. Does anybody have any questions about this section of the rule, of the draft rule set? Okay, hearing none, we can go ahead and move on to the next section. So this is all regarding definitions. We feel it's important to bring those key definitions over from the act, from the bill into the draft rules. And so these mirror what is in the actual bill. However, if you scroll down, Karen, I didn't really hear many disagreement or comments with any of, a lot of this was the same as the last discussion draft that we, at the first RAC. However, we are looking to add potentially a few other definitions that we think might provide clarity for implementation of the bill. And that has to do with definition for, oh, and I also want to mention first that I did remove out of network from the definitions. That wasn't a part of the bill. And it also doesn't make sense in the sense that a ground ambulance service organization, whether they contract or not really is beside the point. And so whether they are non-participating in an insurance plan is really besides the point. A ground ambulance service organization is an entity unto itself. And so in network, they do have the ability to contract if they decide with an insurer. And that is the definition that was brought over from the bill, but out of network really was not relevant. So that has been removed. And you'll see that as we go throughout the rule that's been done. But we were looking at potentially adding a definition for mutual aid transports, because that is discussed in another section of the rules related to ground ambulance balance billing. Also, non-resident and resident are two other terms that are used, and whether or not that would be helpful for clarity for this rule set. I'm looking to feedback from the RAC on this topic. If anybody has any comments now, or you certainly are welcome to submit written comments about this. And we welcome suggested definitions or point us to where that might be a universal definition that would make sense for ground ambulance services. So I'll pause for a moment and wait for hands to raise. Go ahead, Jeff.
Yeah, I feel that resident and non-resident really need to be in there as part of that, and then mutual aid transports really need to be in there too,
Okay.
as definitions, especially being a rural provider that does a lot of intercepts and other and coverage of areas that don't have the ambulance service or as sophisticated or the same level. So
Okay.
I'd like to see all three of those definitions added, please.
Okay. Thank you. And again, we appreciate any suggested language or pointing us to any existing definitions that may be helpful. So I'll put that in, plug in there for those that have that type of information. Anybody else have any questions or comments?
Hi, Lisa. This is Antoinette. I really applaud the DFR going this direction. It's looking to be clearer, at least, as of now with operationalizing this. But we really applaud the addition of these definitions. So thank you very much. And then omitting out of network now is starting to make a little bit more sense operationally. So thank you.
Okay, thank you. And I am looking at the chat too. So thank you for the chats as well about these definitions. Hands up, I see. We'll go to Tim Dooley.
Hello. Sorry, we have a train going by, which
Yeah.
is very loud for us now. All kinds of things noise-wise.
Ah.
We have just kind of a suggested mutual aid definition that I was going to drop in the chat, but happy to put that in written comment too. Just meaning a transport by a Grand ambulance service organization that originates outside their designated area and is requested or subject to an agreement between the two entities, saying, hey, this transport occurred outside your designated ASA and is requested, rather than just like in the old days in the 1970s where many providers would compete for a call, just saying, hey, this is an ask for a mutual response.
Oh, okay. I see what you're saying. All right, thank you. And yeah, if the chat is fine, but we also appreciate a follow-up written comment as well if you have the time. You are one of the other representatives of the ground ambulance organizations. And then I think there was a question there about the source of the definition. If you could provide that too, that'd be great. And
Yeah.
next we'll go to Glenn. You have your hand up.
Glenn Berker with Signal Care covering for Jen Baker. She wasn't able to make it today.
Okay.
I believe the resident and non-resident definitions, we're not opposed to those being included. I believe those were really only sort of utilized within the state, within Washington's data tables to differentiate reimbursement rates, because I did participate in the ground ambulance work groups in Washington when those rules were being developed. But mutual aid also support a definition there just so that there's clarity. So appreciate you guys adding that for everyone's benefit.
All right. Thank you, Glenn.
Thank you.
So yeah, also for resident and non-resident, again, we would appreciate input from RAC members who would like to offer any kind of a standardized definition when it comes to how that's defined for the purposes of ground ambulance services. So thank you. Any other hands up that I'm missing?
This is
Sabrina.
Thanks. Yeah, I've got my hand up. We agree with Tim's suggested definition for mutual aid. We think that makes sense. And then on the resident and non-resident piece, and we'll put this in written comment as well, but we have a question out. There are not all EMS providers charge resident versus non-resident rates, but we'll want to find a definition that works for those who do. And so we've got some questions out to our members that are doing things like that, and we'll follow up with some more information and suggest the definitions in writing.
Thank you very much. John Tasty, please go ahead.
Yeah, I would just like to say I really like Tim's definition of the mutual aid transport. And I do agree with Chief Blake on that we do need to keep the resident, non-resident. And I am one of those people out there that's seeking further information from some of the areas around that do use that in their process. So,
That's
but
great. Thank you. If anybody, I mean, it would be helpful probably to all RAC members if you have a kind of a in operation working, how this might work in operation. Does it have to do with living in the zip code of the service area, or are there other factors that factor in to a GASO, Ground Ambulance Service Organization, making a determination if the individual being treated is a resident or a non-resident? It would be helpful for me to see it in real world operation. If anybody has an example, we won't hold you to it, but it's just helpful to have an example. Okay, I'm looking at the chat and I see some hands up.
And Antoinette has her hand up.
Okay.
Yeah, hi. And just one additional comment surrounding the non-resident versus the resident. I just want to make sure that the definition will be one that fits within the context of these rules, just not from a rate perspective. Hopefully that makes sense, that it just provides the broader meaning and also the meaning also within the context of these rules. So just wanted to make at that point, because I think somebody had offered to provide the definition, and I just wanted to make sure that of what may be helpful in terms of the definition of it.
Yeah, we will, do a, vet the offered definitions and validate them. And, it won't just be, oh, thank you for that definition and run with it. So no worries there.
Thank you.
Welcome.
Yeah.
Jeff Blake, you have your hand up.
Yeah, I apologize. The internet blipped out there for a second. Tim's definition is really good on mutual aid transports. Everything that we do is by request from the neighboring agencies. So I think his definition is very valid.
Okay, thank you. All right, any other questions or discussion that needs to take place for the definition section? Okay, let's go ahead and move on to the next section of the rules. This section has to do with balance billing prohibition and consumer cost sharing for ground ambulance services. Not too many changes here from the last time, from the previous discussion draft. We did remove the out-of-network, reference to out-of-network. We did not replace it with non-participating. It's just a ground ambulance service organization. We did remove a couple of sections of this rule that, based on feedback from RAC members and further internal review, that we feel that some of the authorities that, again, some of this was taken from the Washington rules as an example. Again, we put our own Oregon, we apply it as the way we want to do it for Oregon. However, this level of detail goes beyond what we believe is within probably the statutory authority for the agency, or for our agency, and we felt that it was something that could be taken out of the rule. So we welcome any comments and feedback from RAC members and interested parties about that decision. But that is a decision that we made to do for this latest draft rule set. Any questions, comments, concerns? Okay. Thank you, Jeff. Yeah, we've definitely are still discussing the time period of the 30 business days to reimburse. But we definitely want to talk about this. So let's move on to paragraph 2. And I see first Charlie Fisher's hand up. So please go ahead, Charlie.
Well, yeah, I just was coming in to say that we really support keeping the 30-day reimbursement time frame. If they're waiting 90 days for a consumer to get back thousands of dollars that they shouldn't have been charged in the first place, I think is pretty unreasonable.
Thanks, Charlie. So is there any kind of compromise that anybody wants to suggest kind of between a 30 and a 90-day time period? So that's just something to discuss or to talk about. But before we go there, I see Jeff Blake's hand is up as well. Please go ahead, Jeff.
Yeah, I just want to make it clear, and I understand what Mr. Fisher said. I believe, and correct me if I'm wrong, but very few times are those reimbursements the total thousands of dollars as he referenced for those people. But I think that even at 30 days, just the way our systems work and the fact, like if you're a rural fire protection district, you have a 5-member or 7-member board that signs off on the checks that you have to do. And we meet only once a month. And so timing wise, 30 days could be difficult by the time you run the audit, by the time you finish it. And then based on the regular meeting schedule of the district, it is difficult to make 30 days. I would kind of argue that even the insurance company would have a hard time giving us 30 days or to pay us what we're owed if there's something on the other side of that. So that's where my difficulty with the 30 days. To me, I think it should be not to exceed 90 days, and I think that's a reasonable expectation.
Thank you very much. Charlie, please go ahead.
Yeah, I mean, I guess I totally hear that. I just, I'm thinking from the perspective of someone who has a medical emergency and has to pay hundreds or thousands of dollars out of pocket that they shouldn't have to, and then having rent come due or having to pay utilities and hearing that they have to wait 90 days to get the money that was inappropriately charged in the first place when, their landlord isn't going to give them 90 days to pay their rent. It just seems, from a city or a business perspective, businesses have cash flow that they can use, or they can take out loans to bridge a cash flow problem. A consumer who is struggling to make ends meet doesn't have the ability to do that. And so just, it seems like it's a categorically different thing. And to ask someone to have to wait that long, again, in a case where they were inappropriately charged in the first place, is just way too long.
Okay, thank you, Charlie. And before I go to the other folks with their hands raised, just a couple points to think about with this, and we'll consider everyone's comments. But that, I think Jesse or several others put comments in the chat that 30 business days is longer than 30 actual calendar days. So it could be more like 40 to 45 days. Also, we would think that this law would really would prevent a consumer from paying anything more than the in-network, amount in their plan, health plan contract. So we're hoping that we'll think that this would be a rare occurrence, but on the rarity that it may happen, we still need to have this built into the rule as a consumer protection. So again, I want to hear from everybody, but we'll be taking all of these comments under consideration, just so that you know that we definitely are making note of it. So let's go to Antoinette with Cambia, and then we can go to John.
Yeah, hi. I think this is more of an issue with the gasos, but meaning to resolve by the gasos. So I'll just kind of stay out of it. But I just want to respond to that comment. I think somebody made about even insurance companies would be it would be difficult for us to meet that 30 days, and just a general sort of feedback, under the insurance statutes, depending on what the statute is, it's like we have 30 or 60 or 90, days. So for insurance companies, even if the 30 days will be hard to challenge, if that's what the statute, requires, then, we do it. So I just don't want us to have the assumption that we will be hard to meet this. But, again, other statute, it doesn't really, that the 45 days or 50 days, it's either like 30, 60, or 90 from what I've encountered, depending on what the requirement is. So just wanted to make that point. I know somebody offered 45 days, but I think at the end of the day, just being a person that has also been involved in a lot of rulemaking and trying to operationalize it within the company, I think it's really important to also think about, can this be operationalized? Can we meet this? So to the gentleman that has brought up the fact that, you have to consider the smaller ground ambulance services, I think, that should be factored into whatever date it's decided, because at the end of the day, you want to make sure that it is operationalized and administered, the way it's intended to, or they can do it that way. So anyways, that's my comment.
Thank you, Antoinette. Next, we'll go to John TC.
Yeah, I first of all, I appreciate, looking out for the consumer. I will, us being a rural provider, kind of echo Chief Blake's comments. We can't always operate on a 30-day cycle and get business done. It's truly not at the not at the demise necessarily for the people being served, but I think I feel it's somewhat a little bit disingenuous. But what I will say that I do appreciate the comments for the small entities. It's not easy for us to take out loans or function along, and we run on a very thin line. And so what helps us do business helps us stay in business to serve our communities.
Thank you, John. Okay, thank you for everyone's comments on this. And so we'll do some more discussion and consider all the comments, and we'll have to keep you posted on this. So do some more thinking about it. Okay, let's go on to the next rule set. The only changes that have been made since the last discussion draft were to remove out of network from the reference in the rule. It's all about payments to ground ambulance service organizations. And again, like I mentioned in the last RAC, we modeled, or we didn't necessarily go completely verbatim, but we did take some modeling off the Washington's OAC's rules. Let's go back up a little higher, Karen, just to the beginning of that. So this really is taking the verbatim, the definition over very closely to what is in the bill. That the payments to the ground ambulance service organization is the established local rate, whether it's established by the local government or it's the rate established through a local government's contract with a private entity to provide those services. And those need to be, of course, reported. That will be submitted to DCBS, to the Division of Financial Regulation. Or the reimbursement would be, if a rate's not established, it would be 325% of the Medicare rate, or it'd be the lesser of 325% of the Medicare rate or the ground ambulance bill charges. Of note, we're still discussing it internally, but a commenter who was not able to be here today, I think Pacific Sources comments, called out that the bill or the law that the legislature passed is pretty clear that, it's clear that it's kind of a point in time. So the rate, the Medicare rate as of when the bill became effective, or when it was passed, as of January 1, 2025, I'm sorry, July 1, 2025, that would be kind of a rate set in time. But I think that what I have heard from other comments or other conversations is that, Medicare is reevaluating their rates from time to time. So if the rate does change, it appears that the legislature would need to amend the statute to adjust that the way that it's worded. So again, we're still discussing this internally and with our DOJ counsel, but I would like to hear from folks, and I see Sabrina raise her hand, what you think about this section of the rule. Go ahead, Sabrina.
Yeah, I have a couple thoughts about the point you just raised on the Medicare rate being frozen in time, and then also about this section of the rule. But we can talk about maybe the Medicare piece first. So I would say we disagree quite strongly with Pacific Sources interpretation there. We were the main proponent, the State Ambulance Association was the main proponents of this bill, and freezing the Medicare rate in time was never a conversation that we had during session. So I was surprised to see that argument come up at the first RAC and also in the written comments. So I don't think that tracks with the conversation that was had either with legislators or really on the record. So have concerns with that. Moving on, sort of just to general thoughts about this portion of the rule, there are pieces of it that we really like and appreciate. I'll just flag that the draft rule here does retain the lesser of language for backup rate, which is the bill language actually states that the reimbursement rate may not be less than the 325% of Medicare. And I can copy and paste that in. So I think that lesser of language needs to go to be consistent with the bill language. But we really appreciated the mutual aid language being included. We thought that was great. And we also appreciated the requirement that providers be reimbursed directly. We think that is important for patient protection too.
Okay. So. Thank you, Sabrina. Antoinette?
Yes. Hi. So with respect to the Medicare rate, yeah, I agree. I think B, probably Lisa, it was your intent to correct that one, because I think you said you were going to correct it, the lesser of, but it may have been an inadvertent oversight. So just to match with the statute language. But I was just primarily wanting to comment on I. Yes, the statute that say 325% of the current published rate, given that this is effective on January 1st, 2026, our comment basically did say to use the Medicare rate effective January 1st, obviously of each calendar year, which reflects the most current published, rate for ambulance services. So again, using the January 1st date of each calendar year, it helps operationalize it to align with, standard insurance benefit cycles as well. So that's the comment I wanted to add. So some clarification around that, the date will be very helpful.
Thanks, Antoinette. Let's go ahead and go in order. I saw a hand go up and a hand go down. So does anybody else have anything they want to talk about on this section? Please go ahead, John.
Yeah, so I do want to thank everybody again, especially for the mutual aid language. I think it's important to remember, that the responding providers, local established rate should be the rate that's based on their cost, on these mutual aid calls. And a great example is that we're a very large service provider, rural, backed up against another one. And so our rates are going to be different than, let's say, Albany Fires that's next to us. That's more of a suburban response area. When we go mutual aid to our neighbors to the east, we can be going several hundred miles. So our costs are going to very different than, let's say, a neighboring agency like Albany running 5 miles into our district. So I just wanted to kind of reaffirm that.
Thank you. Thanks for sharing that. Okay, so we'll revisit this section to make sure that it's in alignment with the statute and the legislative intent as well. So yeah, we didn't get to spend more time on this particular section, so we'll have spend some additional time discussing it before the next RAC. All right, can you scroll down, Karen, please? Go ahead, Glenn. Signa?
Sorry, if we're going to move on to like sections 3, 4, and 5 within the specific portions of the rule, I can hold my comment until we get to section 5.
We can move on
Okay,
to 3, 4, and 5. Yeah.
Okay, great.
Of this section. So again, no major adjustments other than removing out of network. So if you have any comments on that, Glenn, please go ahead.
Sure, thank you. So this is piggybacking off of the comments that Antoinette made earlier regarding reliance on the rates that get submitted to the department. There is language within the Washington Administrative Code. I'll put the citation to it within the chat just for reference.
Yes.
But so that was something that came up in the rulemaking process in Washington, and the carriers there voiced concern over having the ability to get any sort of updated rates into their systems in advance of them going into effect. And really, like, the language that's embedded there is really intended to address changes to rates and not necessarily like the initial rates that we started out with. But Washington had started with sort of a November 1st timeframe to get rates in initially, with rates going live on 1/1 of the following calendar year, and then provided a 60-day advance notice framework unless rates had to be changed on an emergency basis. And so I just wanted to echo Antoinette's comments about additional language being included in the rules that would give us the opportunity to get those in place, because that allows us to prepare for that, to avoid rework of claims, additional EOBs and EOPs sent out. So it just provides more certainty and clarity for everybody involved. Thank you.
Thank you. Thank you. Antoinette?
Yeah, and I'm just seeing this regarding allowed amount. I don't think the definition section defines that. And I'm wondering if it's possible for the DFR to define that, given that we are to pay based on the rates and local established rates. So just wanted to make that point in case it was an oversight.
Yeah, I'm familiar with the comments and that you called that out, but we didn't do any rework of this rule before this RAC anyway.
Okay.
But still, we're still discussing those logistics internally with our more technical side of the team that's working on the database and data set. But that did come up recently in conversation that to operationalize this, we may need something similar to like what's been suggested about Washington that Washington has in their rule, and looking at timing and all of that for implementation. So we'll definitely be taking the comments under advisement and discussing that further, and hopefully have something that we can discuss at our next reading, our next RAC meeting. Because we're seeing that is guidance is needed and some clarity to help operationalize this. So
Yeah. Thank you.
you're welcome. Any other immediate comments on this? And again, please, follow up with if you have something new that you want to clarify, having from your previous written comments. Feel free to submit those by the next comment period, or just know that we are still contemplating comments about this section that we already received as well. All right, let's go ahead and move to the next section having to do with GASO reporting, rate reporting to DCBS and DFR. Removed local government entity because the bill is clear that it's ground ambulance service organization, whether it's the government entity or the contractual entity, mostly private entities. Whoever's providing the service needs to report to the agency. So clarified that in our draft rules. That will also help ease administrative burden on the local governments. But there'll still be, we've been talking to the Washington OIC again about their lessons learned, and there will always be a validation process. And so we're already working to get ahead of who all the entities are, where they're operating. We're also meeting with the technical team, or the data team has been meeting with the Oregon Health Authority Emergency Management Services managers to discuss about what data they can share. Again, all looking to ease administrative burden and streamline the operation of this database. However, this is getting into some of the detail about what's expected from these organizations to report. And I think we shared an example of the Washington OIC's database report. I pulled a report and shared that at the last RAC, and that's also posted on the RAC website. But those are where we started with what makes sense, some of the data points, the data sets, we call them, to report. The name, obviously the legal name, the national provider identifier, which is provided by Medicare. And so that makes sense from a billing perspective. Effective dates of the rates, zip codes, procedure codes, how they differentiate between the types of services being provided, mileage codes, also about whether there's a resident or non-resident rate. I see a typo here that I need to fix in sub 3. Got cut off, so it's organization. And here under 3A, we're still discussing the timing. The bill is effective the law goes into effect January 1st, but we also have received feedback from the ground ambulance service organizations that they're willing to work with our agency sooner than later to get existing rate information submitted. So we may be able to work with this still as a date for an ongoing annual basis, but the process might start earlier, so that's why I put in on or before January 1. But welcome to any insights, feedback about this timing question of rate submissions from the RAC, and we'll start with Antoinette. Please go ahead if you have any feedback.
Yeah, I'm sorry, I was on mute. So sorry about that. Regarding the timing, again, with our comment letter, we provided a date because I do understand you said on or before January 1st, which means that it could be as late as December 31st, which could be, difficult for us to administer should we receive a claim on January 1st, for example. So again, we would really appreciate it if the DFR can look to our proposed dates for the submission. Also, if you scroll up a little bit, I think removal of local governmental entity was missed in one of the sentences. Keep scrolling up. So right here, establish local rates for grant owners provided directly by the local government. I think that needs to be removed, correct?
Yeah. Yes, I think you're right. Yeah, we'll rework that sentence. So thank you for the flag on that.
Okay, great. That's all the comments I have. Thank you.
Well, actually, no, on this one, it has to do with the established local rate, which can be established directly by the local government entity, but it also could be a contracted rate. I think that's what this paragraph is about. So we'll reread it and make sure it makes sense, but this is coming pretty much right from the statute. So this particular section, it's just down below. It doesn't make sense that we're asking only the local government to report. It just needs to be the GASO, whether they're public or private.
Yeah.
Does that make sense? Okay. Sabrina, please go ahead.
Perfect, thank you. I think in terms of the annual reporting date, mid-January probably makes sense, maybe January 15th, but like you mentioned, the OSA is happy to work with our members on this first round, especially to get information reported earlier before that January deadline, so that we can start to populate the database. And then Chief Blake mentioned this already, and you also addressed it already, but just another flag again, since there is already a requirement that providers have to update the rates within 5 days of any rate change, theoretically, when we get to the annual date that we pick, those rates should be current, or most of them should be current unless there was a change within the last 5 days. And so as much as we can streamline that process of fulfilling the annual reporting requirement without having to resubmit information that they probably just submitted recently or is still accurate, with like a check here for if the database lists an accurate box, I think would be really helpful.
Okay. Thank you, Sabrina. Go ahead, Antoinette.
Yeah, and you probably may not have gotten to this yet before the draft, but again, with our comment letter, that protective language that's also in the Washington rules regarding if the current rates have not been submitted yet, the rates we should rely on. So if you can also look to that to incorporate in the rules, we would really appreciate it. Thank you.
Yes, thank you. Oh, Tim, please go ahead.
Thank you. I just wanted to ask like an operational question. For local governments, a lot of times we update our rates on our fiscal year basis, which is July 1. So we could be conducting rate setting doing the analysis and the rate setting and all of the public hearings and everything in April, May, June, and with a rate to go in effect July 1. So it could be a mid-year update. And I just wanted to see how the department was thinking about, we'll update it within 5 days to the database, and then for the insurers, again, sort of to some of the previous comments, how frequently would they have to then check back? Because we could, or even do a midterm rate update if the analysis was updated. So just throwing that out there as a kind of a thought piece.
Yeah, thank you for lending us those thoughts, because I think we are still discussing it, gathering information, and trying to wrap our brains around what's going to work, what's going to be able to be operationalized for all entities involved. But we'll take all this feedback to provide some more detail. Probably need some more detail in the rules around this to make it functional for, again, all the insurers and for the service providers. So we'll look to all the comments that have been received so far. We've also been talking to the Washington OIC folks that have already been implementing their bill. So again, thank you for these comments. It's just something that we'll need to talk about internally some more.
Perfect.
Anybody
Thank you.
else? You're welcome. And I'll be sure to review all the chats as well, which is going to be on the record and in the recording. So thank you for those that have been giving the chats information. So really the last section of rules, we didn't get comments from too many folks after the last RAC, other than we did update the actual Oregon laws, chapter 614, that's now been published, where the law exists currently. We are, again, chatting, we've been talking to Washington OIC's policy folks and their data manager. We are looking to do a similar election form for the self-funded plans to opt in, or PEB and OWEB. So that is we plan to follow that example and publish those entities, the names of the entities that have opted in to help all those involved. How smoothly it will go is hard to say. Don't have a crystal ball, but I'm working with our data analytics team and the manager of that team to try to get ahead of this and have a plan to try to get that information collected and posted as soon as we can receive it. So we really are going to more mirror what Washington's doing, but if there's any feedback, comments, lessons learned, we welcome additional comments on this section. But otherwise, there really were not any additional changes. If you could scroll down, Karen, a little bit more. I think it was just these two areas here, and I want to open it up for any comments, questions. I'll go ahead, Antoinette.
Yeah, I wanted to thank you for streamlining the DFR, the Oregon's version with the Washington. I think for those insurers too that operate in Washington, it's great to have that consistency, and also making the opt-in done electronically on the DFR's website. So thank you. Just wanted to
You're welcome.
thank you for that.
You're welcome. But if this is something that works, we don't want to reinvent the wheel too much. So I did not see it before, but I caught a typo here. So just for the record, want to note that this shouldn't have a strike through on the statutes and other implemented reference below. So we will fix that. All right. Any other questions, comments on the draft rules as they are today that anybody wants to discuss now? You're welcome to raise your hand. And if you don't have anything that comes to mind right now, again, you can submit written comments in the format that you prefer. Just, if you could please do that by the deadline that's on the agenda, it's appreciated. Can we go ahead and go back to, just a moment. Okay. Go ahead, Antoinette.
Regarding the comments, if we didn't see a change that the DFR didn't get, that we commented on previously, but the DFR didn't get to it within the draft rules, do you want us to re-comment on that? How do you like for us to approach it?
If it's not too much trouble, feel free to go ahead and to emphasize that was not reflected in the current version of the draft rules, and just want to reiterate that we think this is important. That's probably a good idea.
Okay. Right. Thank you.
Thank you. And we go ahead and go back to the agenda, Karen. Okay, so one other course of business that we need to discuss before we open it up for public comment is we have a standardized form, which many of you are familiar with, or you're now going to be familiar with, called the Statement of Need and Fiscal Impact that goes along with our Notice of Proposed Rulemaking. And while this still needs to be further put into draft, we welcome, again, leading up to the written comment feedback period, which I believe is, I think it's October what did I put on the agenda? I'm not remembering, Karen, for the comments, October 3rd. Okay. Just put the questions out there about our SNFI form, that something for you to think about from your perspective, dealing with these rules, whether it's from an insurer perspective, small business perspective, consumer perspective. We really appreciate input from stakeholders about how adoption of these rules may or may not or affect equity in our state. So thinking about how might these rules impact one group of people differently than another, or not. And then also it's important to think about the cost of compliance for small businesses that might be affected by this rule. And so that is something a theme I've heard from, certainly from some of the ground ambulance service providers. So we will keep those comments in mind. But if there's anything in particular on this forum that any of the stakeholders want to, on the RAC or interested parties want to emphasize for us, that would be very helpful to receive in written comment. So that's mostly what I wanted to say about this document. And again, feedback's appreciated by the written comment deadline. Things that we should consider when we are drafting the final version of this document. And does anybody have any questions about that? Okay, hearing none. I think we are making some good progress today. We are coming up on, we got about 15 minutes left. And so we definitely have time to open it up for public comment. So if anybody who is not a RAC member, is here as an interested party or a member of the public, would like to make any comments about this rulemaking process, including the draft rules, now would be the time to raise your hand or make your presence known. I'm not seeing any hands, so we can go ahead and close the public comment. And I already talked about next steps, so those are clearly put there on the agenda for you as a reminder. And we could probably wrap up a little early today. And I will just say we really very sincerely appreciate the RAC members' time and interested parties' time. I also appreciate the DFR staff time for those that could join today. And I think all the feedback's been very helpful, and we'll be looking forward to getting more information out to you leading up to the next RAC. Karen, please go ahead if you've got some closing comments, advice, other information.
I just wanted to say I will send out the calendar invite for the next RAC meeting.
Okay.
I just handle these 1 month at a time. So
Yeah,
it'll be coming out for the October 16 date.
perfect. All right, thank you for all your help. Everybody have a great rest of your afternoon. Enjoy the sunshine.
Thank you, Lisa. Great
Thank
work.
you. Thank you. Bye-bye.
Thank you.